welcome to Fit for You, the show that teaches you how to live a healthier and more fit lifestyle. Today, we're going to talk about female issues and women's health. And this show isn't just for women. I get a lot of questions from men, as I do from women, about what's going on with the female body sometimes. Why is it more difficult for women, it seems, to lose weight? Why do we have more of the mood swings? I'm going to be joined by Dr. Economus, one of the outstanding OBGYNs in our area and in the country, and we're going to answer some of those questions for you. I hope you enjoy the show. It's my pleasure to introduce to you Dr. Economus, my friend and one of the finest OBGYN physicians we have in our country. We're very fortunate to have you in our area.
Thank you, Mary.
And a fellow American College of Obstetrics and Gynecology physician.
Right.
Thank you so much for being with us.
And thank you for having me.
Yes, we want to talk today about female issues. You know, it's so much easier for me when I'm working with a client to talk to a woman as opposed to a man, because I understand the female psyche and problems and issues so much better. And there really is a big difference. So being a male physician that specializes in this area, it's interesting to get your perspective. But I know you have a lot of experience because you have a beautiful wife and two beautiful daughters. Want to tell us a little bit about Renee and the girls?
Well, thank you. I am blessed and I have a very lovely family, and that has really helped me in my career because certain things you can't read, you can't learn about in textbooks. You know, when my wife was expecting, I learned a lot about obstetrics because I knew the technical aspect of it, but I didn't know the day-to-day ins and outs of how a woman feels. Their weight gain issues, their bloating, the movement of the baby, just their discomfort level, restless legs. So I really learned a lot, and I think it really helped me in my practice, and it legitimized me. So I can tell a patient, oh my God, my wife had that same problem. So I think it helped me significantly and makes me a little bit more relatable in my practice.
And then she brought you two beautiful daughters. Then you had the experience of taking them from infancy to, how old are the girls now?
13 teenagers.
So tell us a little bit about what that experience was like for you.
Well, first of all, the whole childbirth experience, being an OBGYN and not being able to do anything was very difficult. You know, sitting there trying to be the dad, and that was my job. I had to be the dad then. So I did, we got through that, and we were blessed to have two beautiful daughters. And now, 13 years later, I can't believe, we're almost in high school. So we're going through the growing pains and all those good things that happen. And it has helped me to understand how people live their lives and how young women grow into women. So now you're a dad at home, and we have these two beautiful 13-year-old girls. Tell us a little bit about now, because that's the age that I believe you want people to start thinking about seeing their OBGYN. Tell us why. Why is that the perfect time? It's a good age to come in for a conversation, a consultation. We don't have to do examinations as we did in the past. And I think it's improved the whole experience because it makes it more tolerable for everybody. A young lady will come in, oftentimes with her mother. We'll discuss how they are physically, if they started their cycles now, if they're having any problems. We talk about regularity, and we review their entire health history, including their personal history and their family history, to see if there's any issues we need to start talking about for the future.
And I'm going to bring up diet and exercise as we talk through the various stages of a female's life. But at this stage, we're laying the foundation. Diet and exercise, what is your opinion of, how important it is when they're that age?
We need to start young. We try to show our daughters, my wife and I will exercise on a regular basis, and we often go together. We want to show our daughters that you do that on a regular basis, and you can start at a young age. We include them in that to some extent. And I think it's important to talk to them. We do such things as body mass index measuring frequently, and we start that from the get-go. And that'll tell us where people are. Because if your weight isn't in good shape, and if you're not in good shape, it's going to cause health problems, whether it be menstrual irregularities, diabetes, hypertension, all those things down the road. So there's a big push to get the kids exercising, eating healthy, and moving from a young age.
Now, their hormones, how are the hormones developing at this early stage?
All over the place. They're all over the place. So it's a difficult age because they don't understand what's going on. Oftentimes young women have started their cycles and they may not be regular. So that's often why a young lady will come into my office for the first time, because they're having issues there.
Would you say the hormonal difference is the biggest difference between the male and female body, or one of the biggest?
Sure. Young ladies will start developing sooner than young men at that point, young boys. And it's very hard for them because they have hormonal fluctuations, which I half jokingly say, men, we're cavemen. We don't change. We're pretty much the same all the time. Whereas women have those hormonal fluctuations. And the things they go through, it's not their fault. It's their hormones.
Do you find things like refined foods, a sugary diet, definitely can cause or exacerbate the problem?
Sure, because those types of things and the refined foods and all of the processed foods we have are full of calories, and we hear complaints that our young population is overweight, and so that causes lots of problems, and especially at this age they'll start having a lot of menstrual irregularities and hormonal
I think the chemicals are bad too.
Yeah, oh yeah. We don't know what's in a lot of our foods, There are a lot of hidden ingredients.
What are some of the problems that you will see? One of the things we talked about when we were preparing for today was the PCOS. Want to talk a little bit about that, because I think it's fairly common, and I feel so badly with people I've known that have had it. Everything from severe, abdominal pain to facial hair. Tell us a little bit about what that is all about.
It plays into that whole weight issue from a young age. You start gaining weight, it causes your hormones to be imbalanced. Your hormones are imbalanced, you have a little bit more fat, you store some more estrogens, those get converted to male hormones. Those male hormones in a female body cause problems. As you said, acne, oily skin, it's a cosmetic thing. Young ladies want to look nice. They have unusual hair growth. We joke around here, being often a Mediterranean, we have to look around the room at your family. It kind of runs in some families, but then we have to look at hormonal imbalances too. Is that a problem? And does that affect your menstrual cycle? Then in the future, as we get older and they want to become childbearing, it could cause issues with fertility and such things as that in our 20s and 30s and even our 40s. And then as we get older, later in life, these women are predisposed to such things as type 2 diabetes and for hypertension.
What are the treatments that are available for PCOS?
It depends. It depends on whether you're having problems with your cycle, and it depends on whether or not you want to conceive. If you're just having cycle problems, we'll put you on something to regulate your cycle, whether that's birth control or something of the sort, to get things nice and regular, which will then also temper your side effects like the acne, oily skin, and hair growth issues. Down the road, when conception is an issue, we have to get a little bit more aggressive, but simple things like a glucophage medication help your insulin receptors, get you cycling more regularly, and have you ovulating and help you to conceive.
Could lifestyle play a big impact on that? Activity, exercise?
Diet and exercise, and a low-carb diet.
And I think about the low carb or low starch?
Low carbs.
And I think about the exercise too, because when you talk about the insulin factor, cardiovascular activity to burn through some of that. Want to explain that cycle a little bit so they understand? I think people always equate, it's just about losing weight.
Right.
It's not just about losing weight. It's about taking care of your health. How do you feel?
100%, and you have more energy.
Yes.
People come in and they want a magic pill. They want, what can I do to lose weight? Do you have something you can prescribe me? And there are prescription medications for that, but there are risks involved, and those are only really recommended for people who are truly obese, body mass index 35s, 40s, much heavier. At lower weights, everybody wants to take off a few pounds. So somebody wants a diet, somebody wants an exercise. They're not mutually exclusive. The only way to really lose weight, as you say,
and maintain,
right, is to diet and exercise. Is a healthy lifestyle. So we have to watch our intake, and we have to watch what we're burning.
Let's talk a little bit about the cervical cancer vaccination. I know there's been a lot of talk about that over the last several years. Tell us what it's about.
That's another thing we talk about at the young age. It's a vaccination, and it's the only vaccination we have for cancer. And it's given anywhere. It's recommended between ages 11 and 26, and it will reduce the incidence of cervical cancer by 70%, as well as the incidence of such things as genital warts by 70%. And it's a series of 3 shots recommended for young ladies and young men also now.
Oh, men
Young
also?
boys, yeah, young boys.
Okay, and I didn't realize it was 3. I thought it was 1.
It's a series of 3, yes.
How much time in between?
A month, and then I think 4 months after that.
Do you have any side effects or anything you need to worry about? Like, when in between, when you're getting it, like sometimes if you get a flu vaccination, you might get a few symptoms of the flu.
Yeah, no, very minimal. It's an antiviral and it's a shot, and really just symptoms of any at the site of the injection. Really minimal side effects.
What age do you think we should be talking to these kids about birth control?
Well, unfortunately these days I see the population becoming younger and younger that we need to discuss these issues with them because I don't know if it's due to the media or things they see on television, they're becoming active at a much younger age. So you kind of have to gear your conversation to your child at that point because they're still children, but they're in an adult body. And so we have to gear that to the people, but we also have to be cognizant of the fact that there's a lot of that going on.
Do you, will you talk to your patients about if they are going to engage using birth control, using condoms?
Yes.
And let's talk about condoms a little bit too, because do they play a factor in preventing any type of disease?
Sure. They're barrier methods and they prevent direct contact and help to prevent transmission of things as HIV, chlamydia, gonorrhea, etc.
So there is a value to those. Now we've talked about, let's say, this is kind of probably what you cover with girls in their teens to their 20s. Now we're, in our 20s to, let's say, 40s, and we're going to get into their childbearing years. So how do you transition your advice, your frequency of seeing the patient? What should they be doing now when they start to get into that aspect of their life?
What's most important in this situation is to have a conversation with the patient because different women are at different stages of their life. Some women in their 20s are settled down, ready to have children. Some women in their 20s are in college, building their careers. So you have to discuss with them what they want to do. And so you have to ask them, how are you doing? Always review their medical history, their surgical history, and their family history, and then plan for the next step in their life. We do a checkup, pap smear, whether it's every year or every 3 years. The recommendations are changing in there. Under age 25, we want to screen for such things as gonorrhea and chlamydia on an annual basis because those are a lot of unrecognized incidences of that. And also talk to them about good health practices to get them through their 20s and their 30s, to get them through to the change in their life or their childbearing aspect of their life successfully.
Does the female body have a natural propensity to store more fat because we are the sex that is going to carry the child?
That's why women have hips, because they're built to carry babies, and that's what makes it difficult. There are different times in your life, women will notice in their menstrual cycles that their bodies change. They're going to retain a lot of water around the time of their cycle because their body's anticipating conception or pregnancy. So it wants to be ready to successfully carry a baby. So those types of things are different than men, obviously, and so we have to talk to women about any symptoms they might have, PMS, bloating, mood changes, and how their cycles are doing.
Do you find over-the-counter medications for things like that? Yes, no, maybe?
Yeah, they're great. Most women can tolerate all those things with simple over-the-counter medications. Occasionally becomes a problem, and that's when they end up in my office.
Do you find that many women can control or do a better job of that without medication if they incorporate a better, an exercise program and a better diet?
Diet and exercise, remember, recommended every day. A little bit every day really helps, especially during those stressful times. Even though you don't feel like it because you don't feel great, it's important to do that, and it helps women get through that, especially if they keep your weight down too, it helps.
Now, after our childbearing years, we're going to get into our 40s. And I would say the 40s are starting to lay the groundwork for then your 50s and 60s and so on. So the 40s, I would say, is the next decade of change.
Right, things start changing, and that's the hard thing, because women will come and say, I don't know what's going on, I don't feel well, or I'm warm, or my moods are changing, and I don't know what's going on. So it's our job to, once again, have a conversation and figure out what's going on. How are your cycles? Are your cycles still regular? That's a good sign that things are okay. But you could start having changes of the menopause as early as age 38. And you may not be full-blown menopause until the average age of 51. So there's that long period of time that we have to get women through successfully based on whatever their symptoms are.
Now, you can still conceive in your 40s.
Right.
And what I'm assuming that that's probably about the latest you would recommend. Am I?
Well, yeah, the advanced maternal age begins at age 35. But in their 40s, we see a significant increase in risk factors, although a lot of women are conceiving and having babies successfully in their 40s. Fortunately, we have early testing. So we're testing things a month, 2 months earlier than we may have a generation ago. So we're able to get a lot more information about babies and earlier.
And how do we know if we're starting into that perimenopausal phase when, whatever time it is, usually in our 40s? How can you tell?
Hot flashes, mood swings, irritability, and then cycle instability.
Is it more difficult to lose weight when you're in that stage?
Absolutely.
Why?
A number of reasons. The hormones aren't balanced, your cycle's not regular, and it's a metabolism change. Oftentimes we'll pick up a lot of thyroid disease in women in their 40s, which is part of the workup for irregular cycles or menstrual problems. And OBGYNs, I would say, pick up a big majority of these thyroid diseases and send them off to get treated. And then we fix a lot of those problems by simple treatment of the thyroid.
Can you pick up a thyroid disease into your 40s, into your 50s, and you could be perfectly fine, and then all of a sudden...
Yeah, and that's the time a lot of women will start. Women are different than men. Women will go to the doctor, meaning their OBGYN, from a young age. Men don't often do that till later, so we tend to pick things up in women a lot sooner than men because they go randomly at that age. There's no recommendation for them to go. But yeah, we pick things up for them.
I'm going to ask you a really basic question. Are a female's hormones ever balanced? I mean, or is it just part of being a female that, you might have little, snippets, but you're always going to be in that?
And the answer is it depends. Everybody's different. Some women have problems, but it doesn't bother. Some women have problems and it bothers them terribly. So everybody comes at it differently. Some women never get hot flashes. Some women never get cycle irregularities. They'll have their last cycle and then they get on their way. They're done. They're fortunate.
I started to notice probably in my 40s and then, definitely, 50s. But I started to notice in my 40s that I was working out as diligently as I had ever been, but I wasn't getting the same results. I was having to work a little bit harder. And I also found the most important change that I was making transitioning from 40s to 50s where I got the best results was, I was definitely a fanatic about the aerobic activity.
Right.
And I was always doing weights as well.
Right.
But so dedicated to a very, aggressive aerobic workout. Why did I find that as I cut back a little bit on my aerobic, I went from a 60-minute workout 5 days a week to a 50-minute workout every other day, and I went from getting up to maybe a 7.5-minute mile to now maybe a 10 9.5-minute mile. For about, I would say 35 minutes of my 50-minute workout.
Very good workout.
Yeah, 40 minutes. But why am I finding that I'm getting better results at this stage in my life doing a little bit less aggressiveness on the cardio side?
Well, what I find happens to women is that change is a very difficult time when women go through the change and they don't feel well. So they may have a little bit more difficult time exercising, I'm hearing from them. And I do believe a lot of women are eating less, exercising more, and they just have a hard time because their body's going through change. And I think your body's confused as much as it is. And the hormones throw you out of whack and your metabolism changes. And it's a very difficult time to figure out until things settle down. And then I think you find out too, you're going through a change trying to figure out what works for your body because not everything works the same for everybody. People eat differently and people exercise differently. And I think sometimes you need to change your workup out or change your diet at that point to find out what works best for you. There's not one size fits all. So you did the same thing, you changed your workout and are you exercising a little bit longer than you did before, but just not as aggressively?
Differently, yes, definitely not as aggressively. And I probably have transferred that aggressiveness into my weight, my strength training. And the toughest thing for me, and it's so important, is doing the stretching and and the meditation and the calming yoga. Those are the difficult things for me. But I would say transferring to the weight, the aggressiveness to the weight bearing, but that's proven to be very beneficial for me.
Well, and the yoga is good for your core. And core has been a very good thing for women because that's often where women have problems in their stomach area And that is a very good place to concentrate. And I think that helps a lot of women.
You know, I want to talk about the core, because even as fit as I am, and I see this with women all the time, no matter how hard you try, there's no way you can maintain that tight, beautiful core. I'm finding, you know, when you get into your 50s, like you could when you were into your 30s, and even into your 40s, you know, it was pretty good. Why?
It's known your distribution changes, and it tends to be more central, you know, and then we start losing a little bit of height with our bones as we get older. So, and it all kind of packs on there in the middle.
We talked about women carrying a little bit of extra weight, especially in their 50s, 60s, and beyond. Important, right?
Well, you need stores. You need a storage area for your body to help you get through those changes. You need it. It's more important when you're reproductive age because your body's anticipating pregnancy. But as you get older, you'll start noticing your skin's changing. It's a little drier. You lose the hormones. You lose that subcutaneous layer of fat, and you see that's when you start seeing more wrinkles and things like that too. And especially, I think people who are thinner, obviously, you see more of that because you know they lose that fat quicker.
I'm a big believer in a very balanced diet. I don't believe in eliminating any food groups. So that would be our fats, our very high quality carbohydrates, which would be our whole grains, our fruits and vegetables, proteins, you know, and the very good fats like the avocado and the olive oil and things like that. Water's very important.
Right.
Do you agree that, and especially for younger people, well, I say younger people, but I find it with everybody, we've got to get out of that mindset that, you know, fad diets work or eliminating something is going to, it doesn't. You need the balance of all and the highest quality foods.
Right.
Now, the ratio may change because, and I found this interesting, somebody like yourself, you can eat a lot more carbs, right, than you can fat.
I think everybody comes at it from a different angle, and that's where you have to tailor it. I have no problem eating carbs. Other people have no problem eating fats. I can't touch a fat. Fats are very bad for me, but our concept of fats have changed. Not so long ago, we didn't want any fat. Now, as you said, there's good fats, like avocados. That's a good fat. Any fat that is solid at room temperature is considered a bad fat. So we want to keep that very low in our diet. So those are the types of things that over time evolve. And as you said, as you get older, you have to also tailor that because you can't eat so much.
Well, and you know, I'm going to date myself a little bit, but I remember back when I was in my late teens and early 20s, you're absolutely right. If you were into health and fitness, the thing was no fat.
No fat.
They came out with the book, you know, Fit or Fat, Eliminate It. And you know, I did for a couple of years, and it affected my menstrual cycles, and you could see my skin wasn't as glowy, and my hair wasn't as shiny. So, you know, fat is definitely, I think, for a female, in moderation, high quality, important to the diet.
Right. And I do tell people, you said something about fad diets. I am not a proponent of fad diets. But sometimes you need a little something to jumpstart you, to get a quick 5 pounds off or a quick 7 pounds or 10 pounds to help you feel like you're doing something. And I think you can get into maintenance then after that. You know, you're right, it's probably unhealthy to do some of those low-carb diets and things, but I think just as a jump start, it's okay for a short period of time.
And when we talk about portion size, you know, and high-quality foods, let's start talking about restaurants and eating out. What's the problem there?
Well, the problem is, you know, growing up, we never ate out. We ate home, our mom cooked every day, and you knew it was in your meal. Now you go out to eat, and things that don't look so bad, if you read the calorie count, they're awful. And that's the best thing that's happening in restaurants now. They are labeling things. So it's very good to be able to read those things, and you're shocked when you read some of those things. But the difference is the portion sizes are different than they were a generation ago. The plate sizes are different to make you look like you're getting a bigger portion. And the fats and things like that, and the sodium, and they're things that are very detrimental to your health. And a lot of people eat out all the time, and it's hard to take off the weight.
And I know your wife Renee is an excellent cook, and the girls are an excellent, you know, at that skill. And I think that's so important to it. You know, let's talk a little bit about cooking, because even if you are going to eat desserts or something that, you know, is homemade, you're using fresh ingredients.
Right.
You know what's going into it. You don't have a ton of preservatives. You're not using, you know, a lot of processed and cheap stuff usually. So there is a value to cooking.
Well, our background is Greek, and so we can't say we had a purely Mediterranean diet, but we tend to those types of things. Olive oil, healthy lean meats, fishes, and as you said, fresh fruits and vegetables. My wife cooks, and which is, some people think she's strange because she does that. It's unusual, but she cooks most nights of the week, and we know what we're eating, and we control our portion size that way too.
And another element to that, just from the health angle, I think it's really great when the family sits down and has dinner together.
It's important, and that's what we're lacking. That's what we're lacking anymore. Everybody's running here, running there, and we can't do it every night, but you try to do it most nights, and that's a time to talk about how are things going. You can talk about health issues, talk about school issues, talk about social issues. That's when you really find out what's going on.
Talk a little bit about soy, because there's a lot of controversy, especially if you're trying to. One of the toughest things I find with women is getting them to eat protein. They'll eat all the bread and all the pasta and all the sweets in the world. I can't get them to eat protein.
Because it's good.
Well, I've learned to love, I love my good food first. Like, I want my veggies first. But anyway, and I've trained myself that way. It's how you train your body.
Right.
But anyway, so, and soy for a non-meat protein, people go high and low. I have a little bit of a problem with a lot of it. I can do edamame, but I have eczema, and it irritates my... I know there's conversation about cancer. What's the deal with soy?
Well, soy is it's a vegetable, and as you said, it's a good source of protein, and edamame are great. One of my daughters loves it. She'll eat, and she won't eat many other vegetables. So we'll get her to eat the edamame. And it's healthy, and it's good for you. Soy is everywhere. Soy isn't, you go to the health food store, everybody talks about soy. And it's, as you said, a good source of protein, and it's a good vegetable, and roughage and all those good things. Can we say that it's the be-all, end-all? Is it going to help your hot flashes? A lot of women say, I want to go try this soy supplement. We really don't have a lot of proof that it is helpful that way. And we do become concerned, especially as women go through the change into their advanced years into the menopause, these plant-based estrogens, which are, as we said, helpful to hot flashes, mood swings, irritability. But then you do have to balance that with your concerns about what are these estrogens doing to women? Are they interacting with any of your medications? Or if you're taking them, I would guess you'd have to take them in very large quantities to cause problems like heart attack, stroke, blood clot. So, just like anything else, you want to moderate your intake of those types of things.
Now, you're talking a little bit about what I'm going to refer to as hormonal therapy. Do you, and I know it's an individual question, but do you find that hormonal therapy seems to help a lot of women that have the hot flashes and the, severe, postmenopausal issues?
It does, and it's proven, and we've known that for years. The only problem is the Women's Health Initiative study came out in the late 90s, and it showed that women on certain combination hormones, women who still have their female organs, had a slight increased risk of breast cancer. And because of that, our hormone usage was reduced. The recommendation became really across the board, everybody started taking women off hormones in general. And so we found that there are some other medications that have been helpful to help women with their different symptoms. It may not be the panacea that hormones were that helped everything with one simple pill, but we do have things with very few side effects that can help different symptoms.
And does it any age specific? I mean, you think about, is it, when you're taking the pill, aren't you taking a hormone when you're taking the birth control pill?
Right. But that's at a younger age, and it's actually a higher dose than the ones we use in the menopausal years. Yes.
Oh, that's interesting.
The benefit of the pill is just to say there's a reduction in ovarian cancer rates in women who have ever used the pill. So there are some benefits to it. There are some concerns about long-term use with breast cancer and things like that, but there's ongoing research with that too.
You've mentioned several times about family history. It really is an important component, right? Unfortunately, our genes, we have a tendency to follow our genes.
And that's why it's important to know it. A lot of people know very little bit about that. And it's important, and we frequently ask, any changes in your family history? Heart attack, stroke, blood clot. A lot of young ladies have family histories of clotting disorders, whether it be or high blood pressure or heart attacks or strokes that are frequent in their family. And you have to be careful putting them on the hormonal contraceptives because they would be predisposed even more so than the average person to get those types of things. And you need to do something non-hormonal. You
need to look at that naturally at your immediate family. Grandparents, aunts and uncles, how far back do you need to go?
Really, your immediate family mostly is what we're looking for. Even in the history of breast cancer, if we're looking for hereditary cancers, it's hard to get the insurance to cover it if you have anybody more than your mother and your sister that's been involved. So we look at the immediate families and look at the ages that they're involved in things. If you've had colon cancer in your family, you're going to want to get your colonoscopy years, up to 10 years before that. before that diagnosis was made. If there's breast cancer in your family, same thing, you want to start your mammograms at a sooner age than somebody who does not have that increased risk factor.
How often are you recommending a mammogram? I'm glad you brought that up.
American College of OBGYN still says every year after 40.
And you recommend, I'm assuming, that women do their self-examination?
Yes, every month at least. We have a lot of women coming in, they find things, and we identify them early.
And you can teach someone how to do a breast exam. I'm assuming you can go online,
right,
and they can explain to you how to do it and just check yourself every day,
right,
even if you're in the shower and whatnot.
And that's all part of our routine annual examination. When you come in for your routine annual examination, we review everything. You're up to date on your health history, your medical history, any new medications you're on. And then we go to the examination part where we do self-breast examination teaching, as well as your examination, and then your pelvic examination and pap smear, etc., based on your age.
Let's touch a little bit on supplements, because there is so much controversy. Should we be taking vitamins? Shouldn't we be taking vitamins? If we do, what kind should we be taking?
A while back, a study came out that said they can't even recommend a multivitamin. I still believe it's a good idea to take a multivitamin to fill in any gaps that we might be missing. The American diet, a lot of our foods are fortified. Our breads are fortified, our cereals are fortified, so we're getting things that we need that we may not get otherwise. But a good multivitamin is a great place to start for everybody, especially young women of reproductive age, because they need that additional folic acid in case they are not aware that they've conceived, and to help prevent spina bifida, which is important up to the first 6 weeks of pregnancy. And women don't even know they're pregnant until their 4th week. So they've already missed 4 weeks of it. So every young woman should be taking a multivitamin. And then as we move forward in life, calcium is also important. After age 19, it's recommended to take at least 1,000 milligrams of calcium a day, along with some vitamin D, 600, but most of the supplements will add up to 1,000. And that's important until the menopause. That then bumps up in the menopause at age 51 to recommendation for 1,200 milligrams of calcium. That's all good for your bone health.
What about magnesium? Do you need it with the calcium or if you have the D?
A lot of people are interested in magnesium and they take it as well, but really the recommendation is for the calcium and the vitamin D, because the vitamin D gets the calcium into your bones.
And let's talk about the quality of where people get their vitamins. And sometimes this can be confusing because batch to batch could be different. You don't have to buy an expensive brand, but
Correct.
You want a quality brand, right?
Correct. And that's what it's hard to recommend those for long-term use for menopausal symptoms or other things, because the U.S. Food and Drug Administration does not regulate this as a medication. It's a food, so there's really no regulation in this industry, and different batches and can have different doses and different quality. So if you're using it to treat something, it's difficult. But if you're using it as a supplement for your bones or just a vitamin, most of those things are fine.
Any most frequent questions you get asked, would you say, on a regular basis? Anything the most common? If
I could cure the weight gain that women go through in the menopause, then I could retire yesterday. I say that on a daily basis in the office, and it's very difficult for women. And I guess the truth is, just like anything with their cycle irregularities and things like that, everybody is very different. So it's very important to go through their issues and talk to them and pinpoint things. I will ask somebody, do you like sweets? And oftentimes they'll say, yes, that's my problem. I can't get away from the ice cream. Or I love French fries. I can't get it. So I try to get them to cut out something in their diet that is very easy to pinpoint. So if I could help women that way, just one little thing every year, try to whittle things away one by one. Because if you try to tackle too many issues, it's too hard.
And walk. Move. Do something.
Yeah, they have to move. You have to exercise. Diet and exercise, and kick it up a little bit. You'll see people moving, go to the park running, and I'm glad to see them moving, but I'm saying, okay, then you do that for a little while, and then after a couple weeks, you increase your activity level slowly, because you have to kick it up.
The recommendation is 10,000 steps a day. And when I first started wearing a pedometer, and in my average day, and I've said this on the show before, I look down and I think, I'll get my 10,000 steps in, no problem. Now, on the days I'm not running, I could barely get to 5,000. So think about the average sedentary person.
Right.
They're probably only getting a couple thousand steps in a day. You don't realize,
stop.
How unfit are, especially in our part of the country. And now we're getting into this time of year where it's dark at 5 o'clock. So you want to go to bed at 6 or 7.
Right.
Right.
You don't feel like going out.
It's cold. So what are you going to do? You're going to put a blanket and jammies
Right.
on and watch TV.
Right, and your slippers.
Yeah, exactly.
Right.
Yeah, worst thing you can do.
I try, well, and that's what I try to tell them. You got to get out and you got to move. The recommendation is 2.5 hours of moderate exercise a week.
And that's 30 minutes, 5 days a week.
Not bad.
Not at
bad.
all.
And if you kick it up and you do vigorous exercise, you can take that down to an hour and 15 minutes. So that's not bad at all. You know, but as you said, you have to have a little bit of desire to do it. And sometimes it's helpful to do it with a friend.
It's so important because we find the buddy system to be very, very effective, and more so with women than with men. They need, women need that support. They need that little bit of push. Who's having a bad day? Come on, we got to go.
Women are more social. Go for a walk together, chat. Instead of sitting there talking on the phone, go for a walk and talk together.
Yeah, exactly. And if you get a mile in 20 minutes, when you say step it up, then try to get, a mile and a half in 20 minutes.
The time flies.
Exactly. And I tell people too, if you're going to buy a piece of exercise equipment, don't stick it in, a basement, for example, where there's no TV, there's no radio, there's nothing. Who's going to go down there?
Right.
And, you want it somewhere where it's at least kind of welcoming and you have a TV or music or something to keep you going.
And change it up. You get in a workout rut. You do the same workout for a while, you get tired of it. And you find your body doesn't respond to it either because your body's getting too used to it. So try something different. Get on the treadmill, get on an elliptical, do a little bit of weight, need a combination, do all those things because the weight's good for your bones, even men. A study came out today that men are very negligent getting their bone densities checked, which is common. They don't do it. Women do it somewhat more frequently. It's still hard to get them covered for women, but it's important to do that because, the weight-bearing exercise is good to keep your bones strong, less fracture in your older age.
Okay, before we leave the subject matter of diet and exercise, alcohol, because we're supposed to have a glass of wine, especially red wine a day. Then some women will tell me, oh, but it gives me a headache. I'm better off having a vodka. And should we be having anything?
It's okay to have a drink a day. The recommendations are there, but everything in moderation. No more than 5 ounces of wine, 12 ounces of beer, or 1.5 ounces of hard alcohol, 80 proof. So it's okay. Can we say that there's the benefit that we think that the red wine has? There's some interest in that because the French people drink a lot of red wine and they are perceived to have a lot of less heart disease, and they do. But there's a lot of dietary, physical factors, social factors, and maybe they walk a little bit more than us. Too much to translate to our country. But it is okay to have a drink, but you also have to remember it's empty calories.
And, and you made a great point. It's 5 ounces because, the wine glasses are getting bigger and it's so easy.
Yep.
Oh, yeah, I'll have another glass. And then after the second glass or the second drink especially, then you're like, oh, yeah, well, now I'll have that extra. Now I'll have dessert. Throw that blue cheese dressing on my salad and, that cream on my entree. Who cares?
Yeah. Well, and you're supposed to take it with food because it's supposed to delay the absorption of it, too.
Oh, great point.
Yeah.
And some water. When you're having a drink, I like to always have a glass of sparkling water or club soda with me also.
Stay hydrated.
Last point, I think, in this whole subject of, how to do things best. Good relationships. Be happy. Have a good mindset. Important?
100%. Because you're happier. You're healthier. They find a good relationship gets you to the doctor more often. A good relationship gets you out exercising. You want to look good for your partner. You want to work out together. Those are all good things.
And finding the right partner.
100%.
I want to thank you so much for being with us. It's been a great show.
Thank you.
And I hope you'll come back.
Anytime. Thank you.
And I want to wish you and your family the happiest and healthiest of holidays. And I send my love.
And you and yours, too.
And thank you, everyone. And thank you for watching Fit for You. I'm Mary Pepino, and I hope you enjoyed the show.